Hi, this is Dr. Kazmi. Pregnancy is a beautiful and incredible journey, but it's also a period full of major changes and challenges for a woman, not just physical, but also emotional and psychological. Today we'll talk about what happens to a mother emotionally after delivery. But first, let's quickly understand the physical and hormonal changes that lead to it. During pregnancy, a woman's body goes through massive transformations. So first, weight gain is necessary for baby's growth, but can lead to long-term weight retention. Then, hormonal changes. Levels of estrogen, progesterone, prolactin, oxytocin, and cortisol change dramatically. These hormones affect not only physical health but also mood and emotions. There's also the risk of gestational diabetes, where high blood sugar levels can develop in pregnancy, putting the mother at risk of future type 2 diabetes. Carpal tunnel syndrome can happen too, as swelling and fluid retention can compress nerves in the wrist, causing pain and tingling in the hands. Piles or hemorrhoids occur when increased pressure on pelvic veins leads to swollen veins in the rectal area. Anemia and vitamin deficiencies are common as well, with many women developing low iron, folic acid, and vitamin D levels. And of course, back pain, stretch marks, swelling, and fatigue are also common. The day of delivery is a big day. But the challenges don't end there. Physically, the body starts healing, but emotionally and psychologically, new challenges begin. Let's talk about the main emotional and psychological changes after delivery. Postpartum blues, sometimes called baby blues, affect almost 80% of new mothers. So, when does it start? Typically within 2 to 5 days after delivery. The symptoms include mood swings, crying spells, anxiety, irritability, feeling overwhelmed, and trouble sleeping. Why does it happen? It's usually due to a sudden drop in estrogen and progesterone, lack of sleep, new life adjustment, and physical exhaustion. So, how long does it usually last? Well, postpartum blues typically resolve within 2 weeks without any specific treatment. The best ways to manage it are pretty simple. Make sure you get enough rest, lean on support from your family, talk to someone you trust, and try to get some light exercise and fresh air. But if symptoms stick around for more than 2 weeks, it could be something more serious. Now let's talk about postpartum depression, or PPD. This is actually more severe than the baby blues, and honestly, it affects about 1 in 7 women. So, when does it start? It can begin anytime within the first year after delivery. The symptoms can include persistent sadness, losing interest in daily life, feeling hopeless or worthless, having trouble bonding with your baby, or even thoughts of harming yourself or your baby. You might also notice a lack of appetite or sleep disturbances. When it comes to treatment, professional counseling, like cognitive behavioral therapy or psychotherapy, can really help. Antidepressant medications may be needed, and many are safe to use during breastfeeding. Support from family and friends is also super important. And most importantly, if you or someone you know shows these signs, please seek help immediately. So, postpartum psychosis is, thankfully, quite rare, affecting about 1 to 2 women per 1,000 deliveries. You might be wondering, when does it usually start? Well, it typically begins within the first 2 weeks after birth. The symptoms can be really severe and may include things like severe confusion, hallucinations, such as hearing voices or seeing things, delusions, which are basically false beliefs, severe mood swings, extreme agitation, and in some cases, thoughts of harming the baby or oneself. So, when it comes to treatment, immediate hospitalization is often necessary. Antipsychotic medications and mood stabilizers are usually prescribed, and close psychiatric follow-up is really important. This is a medical emergency and needs urgent care. Now, let's talk about some other emotional challenges. Anxiety disorders can pop up, where some mothers develop intense worry or even panic attacks. There can also be obsessive-compulsive symptoms, like unwanted intrusive thoughts about baby safety. And trauma from the delivery experience is not uncommon, especially after emergency C-sections or difficult labors. So, what can help? Family and husband support is absolutely crucial. New mothers really need emotional reassurance, help with daily tasks, time to rest and heal, and non-judgmental listening. Mental health checkups after delivery are just as important as physical ones. If you or someone you know is going through postpartum emotional struggles, please remember, you are not alone. Help is available. Thanks for watching. Like, share, and subscribe. For pregnancy and mental health tips, join Health is Wealth by Dr. Kazmi. And for diabetes-related care, join Smart Living with Diabetes by Dr. Kazmi. Your health is your wealth. See you in the next video.